Good morning, everyone. Welcome to today's lecture on a topic of immense importance and increasing relevance, health economics in Canada. My name is Pirouzi, and I'm excited to guide you through the fundamental principles of this field. Our goal today is to go beyond the headlines about healthcare spending and delve into the economic forces and analytical frameworks that shape our health system. This presentation is designed to serve as a foundational introduction for students and professionals alike. We will explore key questions, such as, what is health from an economic perspective? What makes the market for health services so unique? And what role does the government play in ensuring an efficient and equitable system? We will also touch upon the historical evolution of the field and the central concepts that distinguish health economics from other branches of economics. By the end of this lecture, you should have a solid understanding of why a robust economic analysis is crucial for creating effective, sustainable, and fair health policies in Canada. I encourage you to think critically about these concepts and their application, as they are not just theoretical but have real-world implications for every Canadian. This slide presents the roadmap for our lecture today. We'll begin by establishing some foundational definitions, which is crucial for any academic discipline. We need to be precise when we talk about health versus healthcare because they are not the same thing from an economic perspective. Following that, we will provide a formal definition of health economics itself and discuss why this field has grown so rapidly in importance. This will lead us to the central puzzle of health economics: what makes the market for health services so fundamentally different from other markets, like the market for cars or consumer electronics? This is where we'll discuss concepts like information asymmetry and the role of insurance. Finally, we'll conclude by looking at the types of big questions that health economists seek to answer, providing a sense of the scope and intellectual challenges of the field. This structure will take us from the basic building blocks to a comprehensive understanding of the field's purpose and application. To begin our discussion, we must first grapple with a seemingly simple but profoundly complex question: what exactly is health? For a long time, the common understanding was purely biomedical. Health was the absence of disease. But as early as 1948, the World Health Organization challenged this narrow view with its famous definition, which you see on the slide. This definition is a cornerstone of public health and, by extension, health economics. It recognizes that health is a positive and holistic state of physical, mental, and social well-being. From an economic perspective, this is a very important distinction. We can't simply measure health by looking at a person's medical records. We need to consider their quality of life, their mental state, and their ability to function in society. This complexity is why measuring health is one of the first challenges for health economists. We often use proxies for health status, such as life expectancy, infant mortality rates, or self-reported health, to try to capture this multifaceted concept. Now, let's introduce a core economic concept: human capital. Human capital refers to the skills, knowledge, and health that an individual possesses. From an economic point of view, health is a fundamental component of this capital. A healthy population is a productive population. When people are healthy, they can work more, they are more productive in their jobs, and they are less likely to miss work due to illness. This makes health a valuable asset, both for individuals and for the entire economy. Like any other form of capital, health can be accumulated through investments, such as getting an education, eating a healthy diet, and, of course, seeking health care. However, it also depreciates over time. We naturally face the effects of aging and the risk of illness. This economic perspective allows us to think about health not just as a social good, but as a strategic investment that yields both individual and societal returns. This is a critical framework for understanding the economic case for public health and healthcare spending. With our definition of health in place, we can now define healthcare. Healthcare is the set of goods and services, think doctor's visits, prescription drugs, hospital stays, that we consume to achieve or maintain a state of health. This distinction is vital in health economics. Health is the desired outcome, while healthcare is the input we use to get there. We don't purchase health directly. Instead, we purchase healthcare services in the hope that they will improve our health status. This is a crucial point because it means we must constantly evaluate the relationship between healthcare spending and actual health outcomes. For example, spending billions more on a new technology isn't a good economic decision if it only leads to a marginal improvement in overall health. This input-output relationship is at the heart of many of the questions we will discuss today, such as questions about efficiency and the value of new medical technologies. While discussions about health and money are as old as time, health economics as a formal academic discipline is relatively young. It truly emerged in the 1960s, thanks to two seminal papers. The first, by Nobel laureate Kenneth Arrow, highlighted the unique characteristics of the medical market, such as the profound uncertainty and information asymmetry between patients and doctors. He argued that these features make the medical market fundamentally different from a standard competitive market. The second paper, by Mark Pauly, explored the concept of moral hazard, which occurs when insurance coverage changes a person's behavior and leads them to consume more services than they would otherwise. These two papers established the intellectual foundation for the field, recognizing that standard microeconomic models needed to be adapted to properly analyze the health sector. The field is therefore not just about analyzing health outcomes, but about understanding the complex economic behavior within the healthcare market itself. So, let's formally define health economics. It is the application of economic principles and methodologies to the study of the health sector. It's about answering the fundamental economic question: how do we allocate scarce resources? In the context of health, these resources are things like hospital beds, the time of skilled doctors, and the funding for research. The field examines the production of healthcare, that is, how health services are created using inputs like labor and technology. It also looks at the distribution of these services, which can be based on market forces, government policies, or a combination of both. Finally, it deeply analyzes the role of government, which is a major player in nearly every health system in the world. It's a field that bridges the gap between public policy, clinical practice, and economic theory. To continue our definition, health economics is a tool for understanding and shaping policy. First, it helps us appreciate the sheer scale of the health sector's economic footprint. The numbers are staggering, and health economics provides the tools to put them into context. Second, it is a field dedicated to understanding the unique rules of the healthcare market. We'll explore this more deeply in a moment, but it's critical because an analysis that works for the car market won't work for the hospital market. Finally, health economics goes beyond just the financial side of things. It uses models and data to explore the complex determinants of health. It allows us to ask, is it better to spend $1 million on a new cancer drug or on a public health campaign to encourage smoking cessation? This is a question about the efficiency and effectiveness of different policy interventions, and it is a key function of health economics. This slide summarizes the core arguments for why this field is so vital. First, the health sector is a major part of any modern economy, often consuming a significant portion of a country's GDP. As a result, its performance has massive implications for national prosperity. Second, governments are deeply involved in this sector, whether through a universal health system like Canada's or through a more mixed model like the US. Public money is a key driver of health spending. This means that a sound understanding of health economics is essential for sound public policy. Third, as mentioned earlier, the unique characteristics of the medical market, such as the inherent uncertainty and information gaps, mean that it doesn't behave like a standard market. This requires a specialized set of analytical tools. Finally, healthcare is full of externalities, where one person's choices can affect the well-being of others. This is a classic economic justification for government intervention, and health economists are uniquely positioned to analyze and recommend policies to address these issues. Let's put some numbers to our discussion. We'll look at the US as a case study, given the data provided in our source material. This slide highlights the sheer size of the US health economy. GDP, or gross domestic product, is a key measure of a country's economic output. The share of this output dedicated to healthcare has been growing steadily and dramatically. While the source notes a significant increase since the 1980s, this trend has continued, with health spending now approaching 20% of US GDP. This is an incredible economic footprint. Why has it grown so much? Health economists point to several factors, including the expansion of health insurance, which can lead to higher demand for services, and the widespread use of a fee-for-service payment model, which financially rewards providers for providing more services. These factors create incentives that can drive up costs and spending. This slide presents some raw data to reinforce the previous point. Here we see the national health expenditures, or NHE, in billions of dollars. The numbers speak for themselves. In 1960, the U.S. spent just under $37 billion on healthcare. By 2006, that number was projected to be over $2 trillion. But it's not just the raw number. Look at the percentage of GDP. It has more than tripled, from 5.1% to a projected 16.0%. This growth is not just a function of population growth or inflation. It represents a fundamental reallocation of economic resources towards healthcare. This is a trend that concerns policymakers in every country because it raises questions about sustainability and efficiency. Is this spending providing an equivalent increase in health outcomes, or is it a symptom of a system with significant inefficiencies? This slide provides another perspective on health spending by looking at who is paying. The data shows a massive shift in the financial burden of healthcare. In 1960, over half of all health spending was out of pocket, meaning individuals were paying directly for their services. Fast forward to 2003, and that number has plummeted to just 14%. Conversely, the role of third-party payers, particularly the federal government, has exploded. The government's share has grown from 9% to over 30%. This trend has a profound impact on the demand side of healthcare. When individuals are insulated from the true cost of their care, they have a weaker incentive to be cost-conscious, which can lead to a phenomenon known as moral hazard, where people consume more care than they would otherwise. This shift in payment structure is a major reason why the medical market behaves so differently. Let's consider prices. The Consumer Price Index, or CPI, is a key metric for measuring inflation. This data shows that the CPI for medical care has been consistently higher than the general inflation rate for decades. This means that healthcare is getting more expensive relative to other goods and services in the economy. The rise is particularly steep for hospital services. Health economists study the factors that drive this price inflation, which are complex and include things like technological advancements, a lack of price transparency, and the market power of providers. Understanding these trends is essential for policymakers trying to control costs and ensure the long-term sustainability of the health system. This slide illustrates another key shift: how individuals are allocating their household budgets. In the 1960s, a much larger share of a family's budget was spent on necessities like food, but by 2001, medical care had become the largest category of personal consumption, surpassing even housing and food. This trend reflects a richer society with different spending priorities. As people become more affluent, they can afford to spend more on their health, which is often seen as a superior good. This is a good example of the economic concept of Engel's law, which suggests that as income rises, the proportion of income spent on food falls, while the proportion spent on other goods, like healthcare, can rise. This shift in spending is a major reason why health economists must consider not just costs, but also the economic factors that drive demand for health services. This slide offers a critical international perspective. When we look at health spending across developed countries, a clear pattern emerges. While many countries saw a rapid increase in health expenditures in the mid-20th century, the U.S. stands out as an outlier. It spends significantly more on healthcare per capita than any other country, often double or more than countries with universal health systems, such as the UK. This raises a fundamental question for health economists: is this higher spending translating into better health outcomes? The evidence suggests that it is not. The U.S., despite its massive spending, often ranks lower on key health metrics like life expectancy and infant mortality. This paradox is a central area of study in comparative health economics and highlights the complex relationship between spending and outcomes. It suggests that simply spending more money is not the answer, rather, it's about the efficiency and design of the health system itself. So, Given the complexities of the healthcare market, it's no surprise that governments are so deeply involved. This intervention is often justified by the concept of market failure. A market failure occurs when the free market, left to its own devices, fails to allocate resources efficiently. In healthcare, these failures are rampant due to issues like externalities and information asymmetry. The government intervenes on both the demand side by, for example, providing health insurance to the elderly and the poor, and on the supply side by, for example, regulating prices, licensing professionals, and subsidizing medical research. This slide provides a high-level overview of the many levers the government can pull to shape the health economy, underscoring its role as a central actor and not just a passive observer. This slide provides a concrete figure to illustrate the government's role in the U.S. By 2003, nearly half of all health spending was coming from the government. This is a crucial point because it means that a discussion of healthcare is, in large part, a discussion about public finance. The decisions made by politicians and bureaucrats about funding for programs like Medicare and Medicaid have a direct and powerful impact on the entire health economy. This significant share of spending also gives the government a great deal of leverage to influence market behavior, from provider payment models to pharmaceutical pricing. It is this intermingling of public and private funds that makes health economics a particularly complex and dynamic field of study. This slide summarizes the core reasons why the medical market defies the assumptions of a simple competitive market. First, there is uncertainty. We cannot predict when we will get sick or what care we will need. This makes healthcare a unique product and is the primary reason why health insurance exists. Second, there is asymmetric information. The doctor has a deep knowledge of the product, the treatment, while the patient does not. This asymmetry creates a fundamental imbalance of power and requires the patient to place an extraordinary amount of trust in the provider. Unlike buying a car, where you can easily compare features and prices, judging the quality of a surgical procedure is incredibly difficult. This is a classic market failure that leads to government regulation, such as professional licensing and quality standards, to protect consumers. This slide continues to highlight the unique features of the healthcare market. The prominence of insurance, while a necessity to manage risk, also creates a challenge. When an individual doesn't pay the full cost of their care at the point of service, their incentive to be cost-conscious is weakened. This can lead to what we call moral hazard, where individuals may overconsume services. Another distinguishing feature is the large role of not-for-profit providers, particularly in the hospital sector. The traditional economic assumption is that firms aim to maximize profit. But what is the objective of a not-for-profit hospital? Is it to maximize patient well-being, to grow its size, or to serve its community? The answer is not always clear, and it complicates economic analysis. Finally, there is the powerful role of equity and need. In many societies, including Canada, there is a strong social value that healthcare should be provided based on need, not on a person's ability to pay. This ethical consideration often supersedes pure economic efficiency and is a central theme in health policy debates. This slide brings us to the concept of externalities. An externality is a cost or benefit that is not reflected in the price of a good or service. In healthcare, they are everywhere. The most obvious example is communicable diseases. When an individual chooses to get vaccinated, they not only protect themselves, but they also create a positive externality by protecting the community through herd immunity. This is a clear economic justification for public subsidies for vaccinations. Conversely, negative externalities can also exist. A person's decision to smoke or to engage in other unhealthy behaviors can increase their likelihood of developing chronic diseases, which in a system with shared costs, like insurance or public funding, can raise costs for everyone else. This is a key reason why governments impose taxes on unhealthy products like tobacco and sugar-sweetened beverages. It's an attempt to internalize the external costs of these behaviors. This slide provides a snapshot of the big questions that drive research in health economics. These are not just academic puzzles, they are the policy challenges facing every government in the world. For example, how should a country balance private and public funding for health care? For a developing country, is it better to invest in basic sanitation and clean water or in high-tech hospitals? How should a health insurance plan be designed to minimize costs while providing comprehensive coverage? And what are the drivers of rising healthcare costs? Health economists use their unique analytical tools to try and answer these questions. They analyze data, model patient and provider behavior, and evaluate the impacts of different policies. The field is not about providing a single answer, but about providing a rigorous framework for understanding the trade-offs involved in these critical policy decisions. This slide is a critical reminder that healthcare is just one piece of the health puzzle. Health status is influenced by a combination of factors, often called the determinants of health. Lifestyle and behavior, for example, are powerful drivers of chronic disease. A person's physical and social environment also plays a huge role. Living in a polluted city or in a community without access to clean water can have a profound impact on health. Genetics and biology are also key, as some people are simply more predisposed to certain diseases. Finally, and perhaps most importantly from a policy perspective, are the socio-economic factors. A person's income, level of education, and social support network are strongly correlated with their health status. Understanding these determinants is crucial for designing effective public health policies. It tells us that to improve a population's health, we may need to look beyond the healthcare system and consider broader social and economic policies. To formalize the concept of the determinants of health, we use an economic model called the health production function. This model expresses health as a function of various inputs, including healthcare, lifestyle, income, and education. It's a conceptual framework that helps us ask, what is the marginal product of each of these inputs? In other words, if we spend $1 more on healthcare, how much does our health improve? And what if we spent the dollar on education instead? The model helps us understand the trade-offs involved. For instance, in a developed country, the marginal product of a new, very expensive medical technology might be very small, while the marginal product of an investment in early childhood education could be very large. The health production function is a powerful tool for policymakers because it encourages them to think about the most efficient allocation of resources to maximize population health. This slide provides a concrete example of the health production function in action. A large body of evidence shows that education is one of the most powerful predictors of an individual's health status. The link is not just a coincidence. It works through two main channels. The first is the economic pathway. More education often leads to higher income, which in turn allows a person to afford better housing, better food, and access to services that promote health. The second is the behavioral pathway. Education can improve a person's health literacy, making them more informed about healthy lifestyle choices and better equipped to navigate the complex healthcare system. A classic study by Erasmus provided powerful evidence for this link by showing that mandatory schooling laws, which forced people to stay in school longer, led to a direct and measurable increase in their life expectancy. This is a perfect illustration of how policy outside the health sector can have a profound impact on health outcomes. This slide brings us to a key concept in health economics: diminishing marginal returns. This means that while healthcare is vital, its impact on overall population health is not linear. Early medical breakthroughs, such as the development of antibiotics and vaccines or the widespread implementation of sanitation systems, had a massive impact on life expectancy and mortality rates. These were low-hanging fruit. However, in today's developed countries, with high life expectancy and low rates of infectious disease, the marginal gains from new health spending can be much smaller. For example, the latest cancer drug might only extend a patient's life by a few months, at a cost of hundreds of thousands of dollars. An economist would ask, would that money have been better spent on a public health campaign to encourage exercise? This is not to diminish the value of health care, but to underscore the need for a rigorous economic analysis of its efficiency. We must always ask if our resources are being allocated in the most effective way to maximize health and well-being. To conclude, health economics is a vital and growing field. It is a discipline that provides a unique and powerful framework for analyzing one of the most important sectors in any society. It forces us to move beyond simple debates about healthcare spending and instead ask more fundamental questions about efficiency, equity, and value. It reminds us that health is a product of many factors, not just medical care, and that we must consider the broader social and economic determinants of health. By applying these economic principles, we can design more effective, equitable, and sustainable health policies. The intellectual challenges and real-world implications of this field are immense, and I hope this lecture has provided you with a solid foundation for further study. Thank you.